All right, so a question has come now. What is the difference between different shoes that are available? Uh, this is a very important issue that we face day in and day out as podiatrists. I would say about 80% of the pathology that comes in has some component relation to a patient's shoe gear. And so what we need to talk about then is what an appropriate shoe is. So we need to have this conversation. So what we're looking for in a shoe, and this is the shoe that I like more and more, is the Hoka brand shoe, Hoka. In fact, we have some styles as well as sizes here in our office, and it fits an orthotic in there. The shoe does pass my test, which is it should bend here, but it should not bend in the shank. And you also want to have a good midsole. You can see how thick that midsole is running from the heel down here. The nice thing about the Hoka is that it has a minimal heel drop. Foot drop is the standard term. In other words, there's not as much of a distance between the heel and the ground when it's inside the shoe as it is the front of the foot and the ground. And so that way your Achilles tendon is not tightening up, and all the stretching that you're doing, if you're doing stretches for plantar fasciitis, the shoe is not counteracting what you're doing with your stretching. And so high heels or a shoe with the heel, obviously that is also going to counteract any stretching that you're doing for plantar fasciitis or other things that you're doing. So a Hoka does a good job, and you also get 400 plus miles from this. That's the thing. We as human beings, we're very good at making our good shoes. They become our garage shoes, and then they become our painting shoes. Then they become our gardening shoes. And that's not good. We need to make sure that we're replacing those at least every 300 to 400 miles or 9 to 12 months, whatever comes first. A Hoka, you'll get 400 plus miles. Brooks, New Balance, usually 400 plus miles. Nike, Reebok, you get more like 300. Skechers, only about 150 to 200 I found. But then there's also the myriad of shoes like the Converse All-Stars, or moccasins are becoming popular or coming back in again. Uggs have very minimal midsole to them, and so that can contribute, especially if you're on concrete a lot, pavement. If you've had a recent weight gain, these types of shoes are not good for your feet. This is a shoe that I recommend. I also have several places in town that I recommend that patients go to, but if you're watching this video from afar, not in southern Colorado, then that would be difficult for me to give my recommendations. One national retailer that's all throughout the United States is Trade Home. Trade Home, they do a good job at training their employees. They teach them how to measure and fit shoes. Those are some shoe gear issues that I wanted to review with you. I mentioned also orthotics as well, making sure that the shoe fits in there. And I have another video that you can look at. It's called Differences Between Custom-Made Orthotic and Over-the-Counter Orthotics. So look for that on YouTube as well. Remember, Pueblo Ankle and Foot Care, we're the foot care specialists, and we are a heel pain center of excellence.